So, it's the pandemic. People aren't commuting to work as they usually do, nor do they commute to school, and the same goes for pretty much everything else. With the increasing rate of COVID-19 infection, it wasn't long until the government introduced the movement control order.
Itu kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan mulai 18 Mac 2020 iaitu lusa hingga 31 Mac 2020 di seluruh negara.
What follows after is a sedimentary lifestyle and an unhealthy eating habit. That is why we meet patient CB. Several months into quarantine, she begins to feel a sudden numbness in her legs. But initially she brushed it off, thinking that, this is probably just some minor effects from all the sitting that I've been doing throughout the quarantine. It's probably nothing to worry about. But the numbness continues for a couple of days to a point where it hinders her daily life. Looking for a professional insight into her problem, she pays a visit to the hospital for a medical checkup. A week later, she and the doctor went on a video call to discuss the result.
Doctor, how is the condition of my body? Why does my leg suddenly feel numb?
You see, Miss Allysha, based on your blood test report, it seems that you have high level of proteins and cholesterol. The sudden numbness in your legs might be due to the fact that your artery vessels inside your leg has lost its elasticity and become hard. This condition that you're suffering from is called arteriosclerosis, and it has a very serious effect on your health.
Based on the discussion between the patient and the doctor, we know that the patient is suffering from a health condition called arteriosclerosis. Arterio referring to the artery and sclerosis meaning abnormal hardening of body tissues. Arteriosclerosis occurs when the arteries that carry oxygen and nutrients from the heart to the rest of the body become thick and stiff, sometimes restricting blood flow to the organs and tissues, which results in numbness, say in the leg, for example. This gradual process, also known as hardening of the arteries, weaken arteries and can develop in various organs, most commonly the heart, which would cause other complications in the form of coronary artery disease, which is just a technical way of saying a heart attack, which is one of the leading cause of death here in Malaysia. But putting heart attacks and similar complications aside, let's look further into the patient's situation.
Let me explain what arteriosclerosis is. Essentially, your artery slowly begins to narrow and become thick and stiff to the point that blood flow to the organs and tissue is reduced. Given that the result from your checkup stated a high level of protein and cholesterol in the blood, it is safe to assume that you might develop a arteriosclerosis.
What does that mean, doctor?
Arteriosclerosis just means that there is a buildup of fat, cholesterol, and other substances in and on your artery wall. This buildup is called plaque. The plaque can cause your arteries to narrow, blocking blood flows, and it can also burst, leading to a blood clot. The numbness that you complained about before is a mild symptom. If your condition is left untreated, you might experience pain when walking in the future.
Then, doctor, what can I do to treat this problem?
The treatment for arteriosclerosis includes a healthy diet, exercise, and medication to control or possibly reverse your condition. For medication, I recommend you to take a cholesterol medication to protect your heart arteries and aspirin to prevent a platelet from forming blood clots.
Okay, doctor. Thank you for explaining to me what arteriosclerosis is and its treatment. I'll try my hardest to change my diet and lifestyle for the better.
After that session with the doctor, the patient went to change her diet and lifestyle. With that plus the medications prescribed to her, she successfully got rid of the numbness in her legs. Now let's move on to where the doctor left off. Firstly, we know that arteriosclerosis is the hardening of the artery. which causes it to be thicker, harder, and less elastic. But why did it harden in the first place? Simply put, arteriosclerosis begins with the damaging and rupturing of the artery wall. It is commonly caused by low-density lipoproteins or the bad cholesterol, chemicals from smoking cigarettes, and high blood pressure. After the artery wall is damaged, plaque, a mixture of fat, cholesterol, and other cellular waste, will begin to build up inside the artery wall. As the doctor said, this will cause the artery to narrow and slowly reduce blood flow to the organs and tissues. The effects of this condition can range from minor numbness in the limbs to a stroke to certain death by a heart attack. Understanding the risk factors of arteriosclerosis can help us all to avoid this health problem. First, we should discuss the factors that are out of our control, that being age, gender, and family history of arteriosclerosis. Older people are at a higher risk of getting arteriosclerosis, and the same goes for males and postmenopausal females. The best that these people can do is to get a regular medical checkup so that this complication can be detected sooner. On to the controllable factors. Smoking, high blood pressure, diabetes, lack of exercise, and many others are fortunately within our sphere of control. This means that to avoid arteriosclerosis, a smoker needs to stop smoking, and all the other regular folks just have to adjust their way of life. Eat healthier food, exercise more regularly, and keep their blood pressure and cholesterol level in check. If there is still doubt left after all that, one can have a discussion with their doctor about whether they should be on medications or not. Though arteriosclerosis is a seemingly simple health condition to avoid, many are still affected by it. This is mainly due to negligence on an individual level and the lack of willpower and discipline to change one's lifestyle. True, roasted chicken doesn't taste as good as fried chicken, and vegetables can be an eyesore when they are on our plates, but health comes at a price. Even though the steps to a healthier artery and ultimately a healthier life is hard and awkward to adapt to, it will all be worth it in the end.